And with that, I would like to turn it over to Damaso Reyes. Damaso Reyes is a media and information literacy expert, as well as an independent journalist. From 2016 through 2019, he worked for the News Literacy Project in a variety of roles, including teaching media literacy to students in New York City public schools, training educators, organizing, and leading professional development events. Today, he continues as a consultant for News Literacy Project. He has been published by the Associated Press, the New York Times, the Wall Street Journal, the San Francisco Chronicle, New York Magazine, all just to name a few, and has many awards and accolades to show. And if you check out his bio, you can see more detailed information about him if you're interested. But I'll turn it now over to Damaso Reyes. Thank you, everyone.
Thank you so much. And I really want to thank Michael and Diana for the invitation. I'm looking forward to presenting, and I'm looking forward, hopefully, to answering some of your questions. So feel free to drop those in the appropriate place. It's really great to be talking with healthcare professionals because so much of the language that we use in the world of media and information literacy education borrows from the field of health and healthcare. We talk about things going viral a lot. We talk about sort of vaccinating against misinformation. So it's really great to be able to address this audience. Let's move to the next slide. You can learn more about the News Literacy Project and gain access to lots of valuable information and resources by visiting our website, newslit.org. Next slide. And just to tell you a little bit about the News Literacy Project, we're over 10 years old and we're a Washington, D.C. based nonprofit. And the goal is really to provide programs and resources for educators as well as the general public to help them to become active, smart, and engaged consumers of news and information. And we really want to see this bedded throughout the education experience and available to people of all ages. And as we will discuss, and as what I think you already know, in order to access healthcare, in order to make great decisions about health, about your family's health, you really have to be informed. So we really feel like information literacy, news literacy is really deeply connected to health literacy. Next slide. But and we can hit play. It's really important for us to ground and to frame the information landscape we live in. So this little graphic is showing the development of social media over less than the last 10 years. And as you can see, there are some social media platforms that we've probably forgotten about, but you can see how quickly social media has grown. And I think about my own experience in my own lifetime. Social media didn't exist when I was in high school. The internet barely existed when I was in high school, and I'm not that old. So it's really important for us to think holistically about how the way we consume information, how we access information has changed and evolved. Next slide. So every minute of every day around the world, hundreds of millions of emails are sent, tens of millions of text messages are sent, tens of thousands of people are tweeting, millions of people are searching on Google. Again, none of this existed with maybe the exception of email about 20 years ago. So as healthcare professionals, some of us might have been trained more than 20 years ago. It's really important us to ground ourselves in the way that our patients, our clients, our friends, our family, ourselves are accessing news and information. Next slide. So this is kind of what it feels like, right? We've got this huge amount of information all being funneled to our devices. We're getting alerts 24 hours a day. We have access to more information and more high quality information than anyone in the history of humanity. But we also have access to a lot of malinformation as well. Next slide. And so let's talk a little bit about why misinformation is such a problem, why we should care about it, especially as folks who interact with the public around health-related issues. Next slide. Misinformation, disinformation confuses people. That's part of the goal. It also causes concern and worry. We know that misinformation and disinformation are being weaponized. And next slide. And it causes distrust, it causes confusion, it causes dissension, it erodes civil discourse, it alienates people. These are all really big challenges if you're trying to have a pluralistic democracy, but it's also a real challenge if you're a healthcare professional. This is things that obviously we've seen acutely over the last 2 years, but it didn't start. Health-related misinformation did not start during the pandemic. It certainly became more acute. So this is something that we really can't afford to ignore anymore. Next slide. So where are we encountering misinformation? Next slide. I don't think it'll be too much of a stretch. Social media. Most of us around the world engage with some form of social media on a daily basis. If we're under 40, if we're under 30, if we're under 20, those numbers are pretty close to 100% if you have access to the technology. Next slide. And we see things like memes, images usually pulled from pop culture. They get us to laugh. They get us sometimes to feel nostalgic, but they can also be forms of disinformation, as we see here. Next slide. And as we see here, I don't know how many fans of the Matrix sci-fi movie series we have here, but I'm a huge fan, and I hate to see Neo and company being misused this way. But again, they use these sort of popular culture references. Sometimes it'll be a singer, sometimes it'll be an athlete, sometimes it'll be a politician, to try to spread a message which causes confusion or spreads some sort of disinformation. Next slide. And, again, this didn't start with the pandemic. Vaccines for the past few decades have been targeted by people spreading misinformation and trying to sow fear and confusion. Next slide. And oftentimes, disinformation is cloaked in some level of fact and some level of truth. So, if you read this and you actually look up the Vaccine Adverse Events Reporting System, which is a system in the United States that people can use to report if they have had an adverse reaction to a vaccine, this might really concern you. But what this piece of disinformation leaves out is the fact that those reports are not verified reports. Anyone can access the system. Anyone can file a report. It doesn't mean that it's true. And that's an important thing. But of course, this being a piece of disinformation, it doesn't give you the context you need. The challenge with memes, next slide, is that just by looking at them, we can't tell whether or not they're true or accurate. We have to engage with some other process, some other form of information in order to verify that. And the question is, do we have the skills? Do we have the ability? Do we have the training to be able to do this? It's really important for us to highlight the real world consequences of misinformation. We can click through the next couple of slides. Because poor information leads to bad decisions and can lead to dangerous actions. Information is the foundation on which we base our information, our decisions, and our actions are results of those decisions. Next slide. Of course, at the beginning of the pandemic in the United States, but also in other parts of the world, there was a lot of anti-Asian violence, next slide, that was related to misinformation, xenophobic and racist information that was spread around coronavirus, around COVID-19. Again, people got access to or got exposed to mis and disinformation. They made a decision, they took an action which actually harmed someone else. Next slide. Right at the beginning of the pandemic in late February, early March of 2020, I actually had an opportunity to visit Samoa to do some media literacy education. And one of the things I learned in preparation for my trip was the previous year, there was a measles outbreak in Samoa, which was fueled by anti-vaccine misinformation coming from the United States and New Zealand. Next slide. And again, this isn't, this isn't theoretical. 63 people in Samoa, the tiny island nation in the South Pacific, died as a result of skipping vaccinations, not getting vaccinated, getting exposed to measles. And most of the people who died were children and babies. And it's really devastated this community. So it's really important for us to understand and focus on how important it is that the people we come in contact with in our work have access and understand accurate information. Next slide. In the UK, next slide, we also saw dis and misinformation affecting people in hospitals and affecting healthcare workers. People wanted to discharge themselves in the UK because they had heard misinformation that they were being targeted by healthcare professionals. Again, I know this seems extreme to some people, but there is a subset of our fellow citizens around the world who are very, very susceptible to misinformation. And even if they're not going to make dangerous decisions or take dangerous actions based on that information, the difference between getting a booster and not getting a booster, the difference between getting vaccinated and not getting vaccinated, the difference between taking a loved one to receive care or to take prescribed medications are all things that can be affected by mis and disinformation. Next slide. So it kind of goes without saying, but I think it's really important for us to say that we can't be active and fully engaged citizens if we are not critical consumers of news and information. And critical means being able to interpret, assess, fact check, being able to relate the reliability of the source of the information that you're exposed to, and really being able to understand your own biases and how those play a role in how you interpret information. These are relatively complex skills, but the great thing is that with your help, we can actually teach the public all of these skills. Again, there's a reason why we call it health literacy, information literacy. These are things that we actually do need to teach in a systematic way. And healthcare professionals and public health workers are among the most trusted people. So we really are counting and depending on you to help us help the public. Next slide. So, just to reiterate, obviously information is critical to making medical decisions. What course of treatment will you take? Which doctor do you go to? What sort of preventative measures will you take? It's all based on information. And if you get your information from a chat room on the internet versus a family member versus a medical professional, these all impact your ultimate decision. Information, broadly provides the basis of our understanding of the world, which is why it's so critical that we be able to assess information accurately. It determines how we make our choices, how we set our priorities. It's very, very important. We can skip to the next slide. So now that we've set the landscape, the question is, what can you do? And we are very much counting on and hoping that you will help us with this, because the truth is information literacy, news literacy, media literacy actually is the basis for health literacy, right? These are all combined, the same skills that someone needs to assess whether a piece of health-related information is accurate, whether a particular course of treatment is going to benefit them, or the same sorts of tools they're going to need and to use to assess other types of information in other parts of their lives. So it's important for us to see these not as separate things, but really as interconnected pieces. Next slide. So as I said earlier, the good news is that healthcare professionals, doctors, nurses, registered nurses, nurse practitioners are still seen as very highly trusted sources of information. Public opinion polls said that people might distrust, quote unquote, the medical system, but they tend to trust their doctors, usually because they have longstanding relationships with their doctors, with their medical professionals, sometimes even with the receptionist at their doctor's office. So this is an opportunity to use these relationships to help people get the information they need. Next slide. As medical professionals, as healthcare professionals, it's really important that the information that not we, because I'm not one, but the information that you provide to the public be clear and transparent. And that's really, really important to emphasize, because often, we think and we get access to a lot of technical information. We have to make sure that that information is accessible to people who don't have health and medical training. We also have to explain to people why we are recommending a particular course of action and what information that decision is based on. People may or may not want to access that information, but transparency makes people trust us more. When I was a kid, I was never satisfied when an adult told me because I said so. As an adult, I'm less satisfied when I hear that. It's really important for me to understand why someone is telling me to put on a mask, take off a mask. And I think that that's useful for healthcare professionals, because if we actually have to explain a decision or a recommendation, it forces us to really evaluate whether or not we are recommending the correct course of action. So please try to keep that in mind as you're interacting with your patients, with your clients, with members of the public, even with your own friends and family. The more transparent you can be, the more you can explain the rationale in simple terms, the more likely people are to trust you and to want to take the recommendation you're providing. Next slide. Again, it's really important to prepare people, not just for the particular course of action that you're taking, but help them to understand what's going to happen in the future. I think that this is one of the things that we really did not see as much of during the pandemic. I think there are very few public health officials in governments who got this part right. As challenging and as difficult it is dealing with a pandemic day by day, month by month, it's really important to prepare people for what could happen, both positive and negative. So we can say, listen, if cases decline, if COVID positive cases decline by 50% in the next 2 months, we're going to recommend this course of action. If they increase after we recommend that course of action, we're going to recommend a different course of action. The more that we do that, the less surprised people, and the more we repeat that, the less surprised people are when we recommend different courses of action. Next slide. It's also important to let people know the limits of our knowledge. Rather than making people distrust us, it actually makes people trust us more, because especially when we're dealing with new vectors and new diseases, it's important to tell people what we don't know, so that hopefully it reinforces what we do know and how we know what we know. Again, this is all about transparency and communication. It helps to build trust. And to let people know, hey, we don't know this now, we're working on it, we're learning about it, we're going to have hopefully more answers for you soon. That's really important in terms of building and maintaining that trust, because oftentimes we're asking people to do things that makes them uncomfortable. Maybe they're getting pressure from other sources in society to tell them to do the opposite. So it's really incumbent upon us to help them understand what we're recommending, why we're recommending, how those recommendations may change, because going back to some of our earlier slides, people are getting information from all kinds of sources. And the unfortunate side effect of having access to all this information is that many people don't know how to weigh the source of information. They may spend a lot of time on Facebook or a lot of time on WhatsApp and be in groups where everyone is telling them the same thing, that, for example, they may falsely be hearing that vaccines are harmful. And then they go to their doctor and they hear that vaccines are safe. Well, they've got 20 people or 100 people on one side telling them one thing and maybe using very sophisticated sounding language. And then they have one person on the other side. So that's really what we're up against as people trying to communicate health information. It's important for us to remember that information landscape, that information context that the people we're interacting with, the people we're communicating with, are trying to engage with. Next slide. So it's more than just interacting with one patient at a time, one client at a time. The great thing about having access to social media is that everyone has access to it. 30 years ago, if you wanted to reach a large number of people, you might have had to take out an advertisement in the newspaper. You might have had to write an op-ed. Now, anyone, doctors, RNs, clerks, administrators can have social media accounts and be reaching people using social media. And it's important not just to rely on the institutions you work with. Oh, well, my hospital has a Twitter account or a Facebook account. So I, as a doctor or an administrator, I don't need one. The more people we have promoting accurate information on social media, the better off we are. And I'm going to share a great example of public health communication that went viral during the pandemic. Next slide.
You need to make this. What is it? It's a part of a virus. A virus? Just a part of it, not the actual virus. They're called COVID-19. They have 4 cans and they're coming. 4 cans? Please. What is this? This messenger told me to make them. I've never seen these before. I'll make some new antibodies to get rid of them. Seize the forks. Nice body. Gonna make this place my new home. 4 cans. Seize them.
So this is a great example. When mRNA vaccines began to be tested and began to be distributed, most people who weren't scientists had a hard time understanding exactly how they worked. This example was, while not super technical, got the point across and helped demystify something that was potentially, for some people, very scary. And it reached over 1.2, or was viewed 1.2 million times, which is a pretty big reach for something around a very technical subject, but it was engaged in a lighthearted, interesting way. Now, not all of us are sophisticated, or we can probably find an intern or find a nephew or a granddaughter or a cousin who might have expertise in TikTok, but Facebook, Twitter, Instagram, these are all tools that we can use to share accurate information. And the more accurate information we have, the more likely people are to actually encounter that information. And so it's incumbent upon all of us to think of ourselves as health information messengers, not just when we're in an office or a clinic, but also on social media. So share that accurate information, share those accurate news articles, create fun, things on TikTok or images on Instagram, so that people can actually see from a healthcare professional or a public health official the accurate information that they need in order to make the decisions to protect themselves and their families. Next slide. So part of our jobs, whether it's in a one-on-one patient or client setting, or if it's on social media, is to try to pre-bunk and debunk false information. So there are things that, in our daily lives or on social media, we might start to see a rumor spread. We need to engage with that, especially those of us who are trusted, visible members of the community who have health backgrounds. Next slide. So our good friends at First Draft News have a really great guide to pre-bunking, which is essentially getting ahead of information that's false. And it's important, whether we're pre-bunking or debunking, to use what we kind of call it is a truth sandwich approach. So we start with a fact. mRNA vaccines are safe. We give a warning. Hey, there are lots of people spreading misinformation around mRNA vaccines. In fact, talk about the fallacy. Some people are saying they're not safe, but here's how we know that they are safe. And here's the correct information around it. It's never enough just to say, hey, that's wrong. Or even worse is to repeat the piece of disinformation without providing that important buffer, that important context. We always want to repeat the facts as much as possible, even when we are dealing with misinformation. This is really, really important. So I definitely recommend you guys visit firstdraftnews.org. There's a lot more information about how to talk about misinformation, how to talk about disinformation. We also have some of that information on the News Literacy Project's website. Next slide. So this is one of the resources that we created for the general public, but I think that it's also helpful within the health context as well to really explore how to talk to people about disinformation, whether it's in person. This guide is a little bit more focused to how to engage with some of these conversations online. I think it's worth just walking through. And this is one example of the resources that we have, and you can visit that link up top to find even more. Next slide. So here are a couple of helpful phrases to engage with, and these are good for around the dinner table during holiday time, or when you see something online. And it's really about being conversational, engaging with people from a place of understanding, right? Compassion, empathy. This is really important because oftentimes misinformation, disinformation targets our empathy, right? It targets our fear centers. It targets our desire to protect ourselves, protect our family, protect our community. So someone can believe and spread a piece of disinformation with good intentions, right? They don't know that it's false, and they think that by spreading this or sharing this, they're actually helping their community. So it's really important to engage with people with sort of that knowledge and with that understanding. Next slide. So obviously, I'm guessing most of the attendees here know this without me saying it, but it's always important for us in these engagements to be civil, to use empathy, to let people know that even though we might think the information that they're sharing is wrong, or we might know that it's not factual, we still respect them. People hate to be judged. They're presented with facts that show that the belief that they hold is wrong. They tend to hunker down. They tend to double down with the belief that's false. So how we engage with people is incredibly important. And I'm guessing most of the people listening to me already know this and have a wonderful bedside manner if you happen to be a clinician. But it's certainly, it's important to really emphasize this first and foremost. Next slide. Take your time, especially when you're online. Sometimes you need to keep a tab open or put a bookmark or send an email reminding yourself to respond to something, but make sure that you actually have the accurate information. It's important not just to tell people, hey, you're wrong about that. But you actually, first, you might not say it that way. You might say it more tactfully. But it's important to show, right? This is that transparency part, and show multiple independent sources for the same information. I know this sounds like work, right? Well, we're trying to combat misinformation. It's not a walk in the park. Next slide, please. Again, that empathy part that we talked about a little while ago is really important. Put yourself in that other person's shoes. Try to understand the motivation behind why they're sharing this information. A lot of times people do have very good intentions, even if they're sharing something that's harmful. So it's important to try to connect with people on that level, even while you're trying to correct the mis or disinformation. Next slide. Again, rather than just posting links, it's important for us to summarize and explain why something is incorrect, and then provide the link. Focus on the information and less on where it's coming from. People tend to want to say, oh, well, you can't trust fill in the blank news organization. Force people to engage, not force people, but ask people, encourage people to engage with the actual information rather than just dismissing the source that they may feel or they've been trained to distrust. Because that's a big part of misinformation, right? As we saw on one of the earlier sites, it's about sowing mistrust. It's about getting us to distrust institutions and organizations, which are designed to actually try to help and protect us. Next slide. This is a really important question to ask yourself when you're engaging with someone online, but I think it also applies to talking to people in public settings, in person. Do you want to share to the entire group? Do you want to pull someone aside, whether it's in person or virtually, send someone a DM, send someone a direct message and say, hey, you know, I'd like to talk to you about that thing that you just shared. Sometimes doing things in private actually has more of an effect because people don't feel shamed. They don't feel judged. And I've taken that approach several times and then had the person take the information down or even publicly say, hey, I shared something that was false. So it's often a judgment call, but sometimes working privately can be more impactful. Next slide. Being patient is really, really important. And part of that is persistence. Sometimes you have to keep chipping away. Sometimes you have to come back to someone over time. You may not convince someone in 5 minutes or in one thread on Twitter or one Facebook post, and that's okay. A caveat to that is think about who you're talking to. If it's someone who seems like an online troll, they're not interested in having an actual discussion or debate. They're only interested in poisoning the discourse. So it's important not to engage with trolls. And again, one of the ways you can figure that out is look at what someone's post history is. If someone is just posting misinformation, it might be faster to report them to the social media organization that you see them on rather than trying to engage them, because engagement feeds their popularity. It's exactly what they want you to do. They want you to argue with them, knowing that they're not trying to have an honest and open debate. Next slide. So as we wrap up here and get ready for questions, one of the things that I think that you guys already know, but it's important to share with those that you interact with. Encourage them to check their sources. I encourage them to double check their facts. Remember, a lot of times when you see something on social media, it's designed, if it's a piece of misinformation, it's designed to make you angry, make you fearful. It's designed to activate your emotional centers so that it overrides your ability to think, which is why that share, that like button, that repost button, sometimes we have to take 5, 10, 15 seconds. Don't reshare, don't post, don't like, but actually, is that true? Does that sound too good to be true? Does it so closely align with what you already believe? It seems quote unquote perfect. Those are all signs that you could be dealing with a piece of mis or disinformation. And, there's been a lot of discussion about whether we live in a post-truth world or a post-fact world. Well, I think as people in the health field, I think we know that facts do exist, and facts are crucial. And it's important for us whenever we can to stand up for the idea that facts exist, that opinions are great and people are entitled to their opinions, but they're not entitled to their own facts, because facts are the common foundation on which we can have a discourse, right? We can interpret facts differently, but if we can't agree that facts exist at all, it becomes really hard for us to have civil society. It really becomes difficult for us to have engagement because we can't agree with if it's, what the temperature is outside. We can't, then we can't have a conversation of whether it's hot or cold or whether it's nice weather or bad weather. So it's really important for us to try to stop this erosion in the belief and understanding of facts. Next slide. So you can, again, find us on Facebook, on LinkedIn, on Twitter. Feel free to tweet at us. And now I think we're going to have some time for questions and hopefully some answers.
Yes. Thank you so much, Damaso, for your presentation. I know since the first time we had the initial conversation, I was really excited for this presentation. And I really love how you ended it by saying everyone's entitled to, their thoughts and their opinions on things, but not everyone's entitled to the facts. And I think that's a really interesting quote. So we have a ton of questions, honestly, here. And so the one that's at the top with the most points, the question is, healthcare workers are not the most trusted people in many BIPOC communities, studies show. How do you combat disinformation and misinformation initiated by trusted faith community leaders and many in the congregations?
I think that's a great question. I think that sometimes it's about going to the source, right? If there's a particular faith leader in your community that's spreading dangerous misinformation, sometimes it's just about engaging and educating and informing that person, because they might not know the facts. Just because you're a member of clergy or a lay person doesn't mean that you know anything about how vaccines work or how a virus is communicated. But that doesn't always work. So I think it's important to acknowledge people's distrust. I think it's important to acknowledge, especially the historical mistreatment by medical professionals, because that's often a wedge that people who spread disinformation use. They talk about history. So it's really important for us to acknowledge when mistreatment and oppression has occurred and to talk about things like health disparities. And so by being open in about those things, we can then help people say, hey, we understand where you're coming from. We understand where this distrust is coming from. But we do want to talk about this particular thing, which is really important for you to understand in order to protect your health. Part of what's been happening is we're getting into, especially among communities of color, a vicious circle where distrust is leading disengagement from healthcare, which leads to worse outcomes. It perpetuates the gaps that we're seeing. So it's really important for us, again, to acknowledge and help people understand that we appreciate where they're coming from and listen to people when they express their fears or express their distrust, and keep giving them the information they need. And whenever possible, if there are sources in the community that are spreading this, engage with that source. Try to convince them. Try to educate them. And if it only works 1 out of 10 times, then that's a 10% efficacy rate. You've removed at least some harm from the community. So that's a great question. Thank you.
Another question we have is, this one. How do you suggest handling / combating misinformation that is coming from healthcare professionals, nurses, doctors, EMTs, etc.? Over the past couple of years, there have been some very public and very vocal anti-vaccine ones out there, making it very difficult to convince some people who's right.
That's a great question. I think that part of it is helping people to understand that while there are, that's true in every profession, there are some vocal and fringe voices out there, that the vast majority of healthcare professionals recommend a particular course of action or understand a concept to be this and not that. The fringe tends to be very loud and very vocal and try to use their credentials to express trust. But because, someone may be a, great heart surgeon, it doesn't mean that they know anything about cancer research or vaccines, right? So that's another important thing to help people understand, is that what is their specialty? What is their specialization? Do they actually know about the particular field they're talking about? And then it's always important to actually talk about the actual claim, talk about the actual piece of disinformation, and find the evidence to the contrary and show how many people agree. So if it's like saying, hey, yeah, I know there's this one guy out there saying this, but there are 10,000 people saying this. And here and beyond 1 versus 10,000, because, in some societies, we like the iconoclast. Let's actually dig in. Let's talk about the actual information or disinformation that's being claimed, and let's see if we can get to an understanding or a consensus. Because oftentimes these people are making factual errors. They're just plain wrong on the facts, and the facts are relatively easy to find and to understand. And again, whenever possible, use your relationship, right? If you're a doctor, a nurse, a clerk, an EMT, an administrator, you have a relationship with someone, you can use that as leverage. They can say, well, I saw this guy on YouTube, or I saw this person on Twitter. You can say, listen, you've known me for 5 months, 5 years, 10 years. I'm not lying to you. And here, I'm going to show you how I'm not lying to you. I think that that's a very important approach to take.
All right, next question. Seems to be really similar to the other. How do you handle when healthcare professionals who are spreading the misinformation? Is there anything more you wanted to add, or kind of similar?
Oh, yeah, I think it's if you know the people who are doing this, if you have access to them, if they're working in your company or your facility, it's important to talk to them, right? Because again, just because you have an MD or an RN behind your name doesn't mean that you know everything about everything, right? So it is important to sit down with them and to talk with them about what they might be confused about, or why they might be spreading certain information, or what their sources are. And sometimes that might take time. But it's important to, if you can, to engage with that person, because again, they may have the best of intentions, but they just may be wrong on the facts.
I'm hearing a lot is we're going to need a lot of patience, and we need to stick to our guns.
Absolutely.
Another question I have is, what is the difference between disinformation and misinformation?
That is a great question. So misinformation is the umbrella category for all types of information which are false. Disinformation is a subset of misinformation, and disinformation is a type of misinformation which is purposefully created and purposefully spread for the goal of confusing, fooling, convincing people of something which is untrue. So not all misinformation is disinformation, but all disinformation is misinformation. And the thing that combines them together is that they're false, right? So it's a question of intention, essentially.
Great. The next question is, how do you address misinformation that's coming from a government authority?
That's a great question. And it's a challenging one. I mean, it's not easy is the answer. But so I think that part of it is trying to address or understand what the source is within the government. If it's an elected official, then, just because someone's been elected doesn't mean that they know anything about medicine, right? So it's important for us to, for the same reason as someone, oh, wow, I love this musician's music, and they're telling me that I shouldn't get vaccinated. Well, what does a musician know about, public health policy? So it's important to help people understand that, yes, this person may be respected and this person may be elected, but they're wrong on the facts. And I think it's always, whenever we're talking about misinformation, it's always important to go back to the fact. What is the fact? What is the piece of information that we're arguing over? Because it's less important where it comes from than what it is, right? Because we can all be wrong. And this actually goes back to an earlier slide where it's, let's admit what we know and what we don't know, right? Let's not try to pretend that we are perfect, omniscient messengers of correct information. And it's important to say, hey, sometimes I'm wrong. But when I'm wrong, it's really important for me to admit that I'm wrong, right? It's also important for me to admit what I don't know. And it's also important for me to explain how I know what I know and why I'm claiming to say that you should do X instead of Y. A lot of times when we're seeing disinformation from government sources, we're not seeing all those things that I just described. So it's a little bit challenging. It can be challenging. It can be, we've seen this in governments around the world, but it's always important to start with the fact. This is what the body of scientists, the body of medical professionals recommend. And I know that it's at odds with maybe this elected official or maybe even this government body. And sometimes that's because, there isn't necessarily a clear choice. Sometimes it's for political or partisan advantage. And when we see that, it's important for us to call it out. But it's one of the most challenging sources of mis and disinformation to deal with. It is not easy, and I will certainly not claim that it is, but always start with the piece of information or disinformation and work your sort of way back from there.
I've lost my place. Oh, okay. How can we combat against disinformation from sources who feign transparency and communicate simplicity to falsely build trust?
I think it's important for us to examine whether or not they're actually being transparent, right? If someone is feigning transparency or falsely claiming transparency, it should be fairly easy to show that they're actually not being transparent. I think communicating simplistically is not always a bad thing. I think we should try to be as clear as we can for the audience that we're trying to reach, right? We're going to talk to medical professionals differently than we would talk with the general public. We're going to talk to different segments of the general public in different ways in order to be able to reach them. I don't think that's a bad thing. I think that a lot of times in our health communications, we are overly complex. And that doesn't mean that we need to dumb things down or oversimplify things, but it does mean that we need to try to hear what we're saying through the ears of the person we're talking to, so that they can understand what we're trying to communicate. So when someone's being overly simplistic, I think, it's important for us to point that out, right? A lot of times people who spread mis and disinformation, they're being simplistic on purpose, right? They're trying to avoid complexity. They're trying to avoid nuance. And as medical and health professionals, we understand that a lot of times health-based decisions are full of complexity. It's not that you should do A or B, it's that you should do A if these 17 factors, right? And maybe in every conversation, we don't need or want to talk about those 17 factors, but we can say, hey, I think this person is being overly simplistic about this issue. This issue actually has a bunch of factors that go into it. And here are 2 or 3. And I'm happy to talk more about why this is a little bit more complex and not quite as black and white as this person is making it out to be. And by the way, I think that one of the important things is that we should always be willing to engage in a conversation, even about things that we don't think we should have to explain or we shouldn't have to communicate, right? They call them patients, but it really should be the healthcare professionals who should be called patients, because sometimes we have to really take our time in order to engage with people. And I know that there are a lot of things in our healthcare system that do not focus on giving us the time that we may want with the patients or clients that we need to or want to engage with. But this is why using some of these other modalities, using social media, right? You may not have the extra 15 minutes to talk with a single patient about the complexity of mRNA, but you can make 5 TikToks to do that. Or help get your daughter to help you make 5 TikToks to do that if you don't feel skilled in it. But engagement is really crucial.
Absolutely. Next question is, are there programs that can teach children the skills of media literacy?
Why, yes, there are. The News Literacy Project is I would say, obviously I have a bias here, is one of the best. They have a great online e-learning platform called Checkology. So it's checkology.org. And anyone, parent, teacher, grandparent, can sign up for free. And it has 15 different lessons that explore different aspects of news and media literacy, as well as how to do fact checking, what the standards of news should be, how to understand bias. If you go to the National Association for Media Literacy Education, namely, has a lot of great resources as well. First Draft, who we talked about earlier, First Draft News also has lots of resources. So if you are a parent, if you are a grandparent, if you are an aunt or uncle, one of the things that you should definitely be asking the educators in your young people's lives is, are you teaching media literacy? Because if they're not teaching media literacy, if the young people in your lives are not being exposed to media literacy, they will not be prepared to enter the real world, quote unquote. They will not have the tools, because it is impossible to tell misinformation from fact-based information without training. It is very, very sophisticated. The people who create this information, their whole goal is to fool you, right? These are people who spend, a lot of their time and energy trying to get you to believe things which are not true. And if you don't have the training, right, it's media literacy is like any other kind of literacy. It needs to be taught. So I would definitely encourage the educators of your young people to learn more about media literacy, but also to access the many high quality free resources that are now out there, which is a huge advantage over, say, 20 years ago, when a lot of these resources did not exist.
Yeah, we got so many questions. I don't think we're going to get through all of them, Damaso, but I have one here that's about different languages. So many of the resources I've looked at are in English. It would be great to have the same reliable information available in different languages so that it can be used to talk to family and friends. Any suggestions for sites, videos, articles, or anything else?
Yeah. So First Draft News, we talked about earlier, actually has translated a number of their different courses and lessons into multiple different languages, including Spanish and French and um, various other languages. The News Literacy Project has a few resources in different languages, as well as, namely, the National Association of Media Literacy Education has some resources in different languages as well.
All right. We got 3 minutes, I see. This one's interesting because you've talked a lot about engaging people with facts and so forth. And this one, Marissa asks, how do you determine when not to engage with someone, i.e., are there tips to spotting bad faith or unequal playing fields?
Yeah, I think that in that case, you really have to, if someone's on social media, you have to look at their account, look at what they post. If they are constantly or solely posting mis and disinformation or solely posting on one type of ad hominem attacks, things like that, this is someone who that's what they do, right? That's their lives. If you do engage with someone not knowing they're a troll, how do they respond to you? Are they open to information? Do they try to just move the goalposts? Do they try to change the subject when you present fact-based information? This may be the sign of someone who isn't interested in actually having a healthy conversation. If people are, again, using foul language, if they're doing ad hominem attacks, if they're attacking the person and not the information, if they say something like, oh, well, you're just an agent of Big Pharma, that could be a sign that this person is a troll because they're not interested in engagement with information. They just want to try to attack you or try to provoke a response from you.
What about instances that are not the social media, if in person?
I think many of the same things apply. If you have a conversation with someone, you can usually sense pretty quickly how they're responding. And again, if they respond by attacking you as a person instead of responding to the information, that could be a sign that this person is maybe too deeply dug in to reach. If they respond with extreme hostility and you're not provoking hostility, then again, that could be a sign that this may not be someone who you may be able to convince or to be able to reach. And that's sadly the truth. But persistence plays a role in this too. So sometimes people who are very hostile at first, if you don't respond with hostility, you can actually get them to engage.
Okay. Yeah, this one's, let's see. When does content being declared misinformation by one violate free speech of another?
Well, in the negative 5 hours I have to discuss this very complex issue, at least within the concept of free speech or freedom of speech is, there's a lot of variation around the world, but speaking within the American context, we usually talk about free speech within the context of government prohibiting you or someone or an organization from saying something. Social media platforms have always had some level of regulation or moderation. Even within our societies, there are things that even in the United States with the First Amendment, which guarantees free speech, there are types of speech which are illegal, essentially, right? Free speech doesn't allow me to conspire to commit a crime, for example, or to slander someone. So when we talk about misinformation, while it may be legal to spread misinformation, we could say that it might not be moral or ethical too. And so if you're a social media platform, you can say, social media platforms restrict all sorts of things. Some restrict nudity, some don't. But the right to lie or the right to be lied to within a private organization or a private setting is not guaranteed by any law. So I think part of the question is, whenever we're talking about regulating speech, whether it's in public or private or government or commercial, what is the harm caused by the speech? And what is the harm caused by restricting it? This is something that lots of people who are smarter and better paid than me spend a lot of time arguing about. I don't think there's a consensus yet, but I think it really is important for us to acknowledge that speech can cause harm. And so then, whether we're talking about a private setting or a public setting, what is the balance between allowing people the freedom to say things which cause harm versus regulating that speech or denying that speech in one way or another? I don't think there's a simple answer, certainly not in the amount of time that we have left, which is 0. But thank you so much for your insightful questions and for the opportunity to address you.
Yes, and thank you, Damaso. And I think that's a great way to end it, because it's something that's also room for debate. And so hopefully it continues conversations moving forward. So I appreciate you and your time and your presentation today. And to all the participants, make sure you fill out the session evaluations and the overall conference evaluation on Thursday. Thank you, everyone, and have a wonderful rest of the conference today. Thank you.